So to diagnose if there's any problem wrong with the bile duct or the pancreas, there's one method of imaging. Okay, because you know that these structures are structures that are buried deep into the abdomen. Okay, so for you to visualize them, you might need something that will aid you to see inside the abdomen. Okay, and one of these methods is what is known as the magnetic resonance cholangiopancreatography. Alright, so this is an imaging and procedure just like the MRI scan. You know the MRI scan, the full name is what? Magnetic resonance imaging. So this one, you just remove the image and you put cholangiopancreatography. So that means in this type of MRI, you are trying to focus at the what? Bile duct and pancreas to see if there's inflammation, if there's dilatation or any problem, if there's formation of stones in it and all the stuff. Okay, so moving, we'll be defining it. All right, we'll talk about the uses, talk about the procedure, talk about the advantages, then talk about what? When it is needed. That's the indications, right? So it's just MRI, but just that this one is special. You're trying to observe what? The bile duct and the pancreas. Okay, so talking about the magnetic resonance cholangiopancreatography, we say that it is a non-invasive imaging technique that uses the magnetic resonance imaging to visualize the bile and the pancreatic ducts. Okay, so let's talk about the uses. It can be used to diagnose what? If there's any disorders of the pancreas or the bile duct. Okay, you are trying to observe the pancreatic duct, not the pancreas itself, but you observe the pancreas too, right? But you're trying to look at the bile duct and pancreatic ducts. Okay, so my bad. Then you are trying to also evaluate abdominal pain, jaundice, and pancreatitis as inflammation of the pancreas, right? You are trying to dictate gallstones, tumors, or strictures in the bile duct. Okay, then you are trying to plan your treatment for gallstones, pancreatitis, and pancreatic cancer. How are you using this to plan your treatment? You are using this to plan your treatment because you are trying to look at the extent to which the disease condition has affected the person. Do you understand? So that you know which type of treatment modality are you going on for, medications or surgery. And if you are going on for medications, which level is the disease at? Okay, and which medications are you opting for and all the stuff, right? You can't decide all the stuff without seeing the organ that actually has the problem. Okay, then this magnetic resonance cholangiopancreatography has a procedure and it's simple. First of all, the patient will lie on the MRI table. This is the MRI table right here, right? The contrast agent may be administered just to enhance the image quality. For you to get clear images like this, it could be that the patient took in some contrast. All right, then the MRI machine will now be on just to generate detailed images of the bile and pancreatic ducts. Okay, they're talking about the advantages of this method. It is non-invasive. You don't need to go through the person's body to know what is happening in the person's body. It's non-invasive. There's no radiation, right? Then you end up with high resolution images to help you treat better. Okay, then it is so specific to the extent that it can help you dictate the smallest of stones and tumors too. All right, they're talking about when this method is needed. If you suspect that there's a gallstones or bile duct obstruction, if you suspect that there's inflammation of the pancreas, that's pancreatitis, or if you suspect that there's a pancreatic cancer, all right, then if you see that there's some abdominal jaundice, abdominal pain or jaundice, all right, then you are trying to do this imaging if you have some pre-operative planning for pancreatic and bile duct surgery. Okay, do you know what is pre-operative planning? Before you go into the operation room, you need to plan so that you don't just go cutting anywhere and all the stuff, right? You need to know which direction the bile duct has inflamed to. It could inflame and change directions, right? So you're trying to do all these imagings just to help you. Once you go into surgery, you just go straight up to the point, okay? So that's it about this magnetic resonance cholangiopancreatography. See you guys pretty soon.